Welcome to Get Moving TV. I'm Dr. Chris Landon. I serve as your host. We have a returning guest today to really talk about the future, because the future is now. I've been at this in medicine since 1973-ish, long time, and we have seen incredible things occur. Just in terms of now I can fix spinal muscular atrophy, a genetic disorder at birth, muscular dystrophy at birth, but at a cost of $1 million, $3 million. Cystic fibrosis, we have drugs that now cost $325,000 a year, but they're going to make a difference for someone living to age 12 or 19 or 28 and drowning in their own mucus, and allow them a full life. Where now my practice has changed, where I have to worry about rectal exams in adult patients. So as a pediatric pulmonologist, I am so happy to move people beyond. So what we have is a future as a race. As humans, we have a whole different set of things that we need to be looking out for. I've been harping on nutrition and exercise for years, but with me today is Dr. Fishman, who's going to talk about regenerative medicine and where science is going. Dr. Fishman.
Nice to see you again, Dr. Landon. Thanks for having me as always. Basically, the discussion I wanted to have today was on regenerative medicine. It's been given that title because it's different than the kind of medicine that you and I practiced initially. Everything we practiced initially was reactive medicine. People didn't come to you until they were sick, and they needed your help after they were sick. What we're trying to do now in the field of regenerative medicine is to take care of the patient so they don't get sick like that. And so it is new, and the way in which it's done is really quite different. It isn't going to be just pharmacologic treatment. They're going to come to you for pulmonary problems, and you're going to say, well, you're going to take this inhaler for bronchodilation. We have to cut out the secretions. We're going to give you one of the pulmonary. We're going to give you one of the corticosteroid inhalations, and those types of things. But they're already coming to you. They're in trouble. Same thing, they come to me as an orthopedic. They're already bad with their knees. They're already bad with their shoulders. What if we have ways so that it doesn't get to that, and that people can live at least, if not longer lives, at least healthier lives? So when we talk about regenerative medicine, the hope is, I don't want to say the promise, but the hope is that we can expand the normal healthy lifespan, or the health span of a patient. So if you doubt what I'm saying, go into the nursing homes. Watch what's happened when you to some of the elderly. They're just, they're being, just watched in the home like they're just being babysitted. It's terrible. What if we don't have to have that? What if you could live a long life and be healthy? Even if you didn't live super long, you lived till 80, but you were healthy every single day of your life, and you were vibrant doing what you wanted to do every single day of your life. This is really the goal of what we do in regenerative medicine. And there's different ways and different protocols that we do that in order to get that to happen. One of them, and you've brought this up in the past, is basics first. You have to be careful what you eat. It makes sense to be careful what you eat, get some exercises, make sure you're well hydrated, and these are things that you've been saying for decades, okay? And that hasn't changed, okay? People don't always listen. And at the back end, the same thing. Not only what you do, but what you don't do. You don't want to be, we're highly, don't smoke, okay? Don't take drugs, okay? Be careful on the alcohol intake you're doing. So you have to be on both sides of that, what you have to do and what you shouldn't be doing. And then in the middle, as physicians, we can be of assistance, okay, if you can do that. We can use various modalities, and we can go into them when we can use stem cells and exosomes, which we can get. Another thing that we can do, we use low-level laser therapy, hyperbaric oxygen that we can use to help stimulate some of the cell mechanisms, bioidentical hormones to help the body kind of keep the way it's functioning. We also have new types of I don't want to say I don't want to call them pharmacologics because they're not really drugs, but they actually help increase the telomere length. We can help stabilize the very DNA in your body so that as you go ahead and get older and the cell divides, You find as these telomeres shorten, you don't get senescent cells, which then go bad, and then can help promote tumor growth. Okay, so there's ways we can take those cells out. There's ways we can avoid some of that happening to begin with, add it to everything else that we did.
Well, I have a friend who I walk with. He's a plastic surgeon, and we're both in our 70s. And boy, we went by Rainbow Bridge, and he wanted to just hit every single vitamin in there that was going to do it. And he was heading off to a conference in Las Vegas about living longer. And I said, oh, gee, it's, everybody on that stage has a New York Times best-selling book, and what the heck is going on here? And so next week we walk on Sundays. He came back. He said, well, the first lecturer said, if you want to live longer, don't ride a motorcycle. So telomere lengthening is part of it, but also what we do with our lives in terms of putting them in danger, putting them in situations. Every time I read about a skydiver whose chute didn't open or whatever, well, they got up there for a reason. We don't want to be caught in our rooms in a giant cotton ball, afraid to touch anything. So how does this intersect with having a life?
Yeah, but you still want to have your passions, okay? It's what keeps us alive. It keeps us what's psychologically involved in our community. I think I think COVID-19 has taught us some valuable lessons of being locked away and what happens to our psyche, no interaction with our family, and no interaction with our friends. And so the psychological component is also just as major a component as what you eat and the things you do have to do and the things you shouldn't be doing, like with the smoking. You still have to keep vibrant. You still have to do what you love in life. Find something that you like to do in life. That all adds to keeping your neurobiological system functioning as normal as possible. Again, if you're going to ride motorcycles, you're going to jump out of airplanes, you're taking some significant risk. But if that's what keeps your juices flowing, who am I to say don't do that? Okay, as long as you understand you took the risks. So I'm kind of open to doing things that I think are a little on the crazy side, if that's what there's some adrenaline junkies like, and they say that's what keeps me alive, that's what makes me get up in the morning. How can you be too critical of that, as long as they understand, you can be smashed on the side of the road or on the side of a mountain with this stuff. So I'm okay with doing risky stuff like that. And many of them want to keep in good health. And we do get those people in who turn around and say, gee, I'd like, I'm getting a little achy here, I'd like to have, what about can stem cell or can the exosome help? What about low-level laser? I've heard of that. The laser itself with these long red wavelengths, they're very long, and same thing with the infrared. These long wavelengths penetrate deep into the tissues, and they help your own system regenerate some of their normal function. And again, they seem to work more on the epigenetic type of function as well too. And so that's helpful. I think the hyperbaric oxygen, if you look at some of the Israeli studies, although you're in for a long time, they were doing this like 2, 3, 4 times every week, it seemed to increase the longevity of the person doing that. Again, they're taking that as an isolated type of a thing, but I think all of the things that we talked about also work. Bioidentical hormones. Although it's a little out of my wheel well, I work with Dr. Masur. Dr. Masur is an internal medicine doctor, and this is really an area where he shines. And so when we're trying to give the best to our patients with regards to whether I'm using the low-level laser, whether I'm injecting stem cells, whether I'm going ahead and using hyperbarics. Some of these people, as we get a little older, I use the word we, get a little older, we find some of our endocrine capabilities slowly diminished, and this can help boost that up and sometimes give us a little something extra along with everything else that we just talked about.
Yeah, I have the whole, is it all T4, T3? It's, and
exactly.
How to truly treat hypothyroidism.
Exactly.
Okay.
Yeah.
But exosomes, tell me a little bit about exosomes. We'll take a little definition of each of these one at a time.
Well, the exosomes actually come from the stem cells. Stem cells, how that works, these stem cells get signals from the milieu, the environment. And these exosomes, they spit out, and these exosomes have all of the molecular signals. So they go to these cells that seem to be injured, are having a rough time regenerating, if they're possible impossible to regenerate them, and then they'll go in and they will use the epigenetics that actually turn on and off the various function of the cell and certain proteins. So if you're a cartilage cell, you want to make more chondroitin sulfate and keratin sulfate. If you're a muscle cell, you want to make more of the epimysium and those types of things. If you're a nerve, you want to make something different. And it goes into these cells. It gives them a little bit of the blueprint, and that the cells are there. So that's where the stem cells work. They go ahead and they release these exosomes. You can get the pure exosomes and inject those because they're 100 microns, very small. And they can get their way into different tissues very easily. They bypass the lungs. Sometimes stem cells can't. They're bigger. They get trapped in the lungs, which can be a good thing if you're trying to treat a lung problem, but it may not be good if you're trying to treat a neurologic problem. These can even enter the blood-brain barrier. So that's exosomes. They're small, little vesicles, 100 microns in diameter, and they have all of these signals that tell the cells what to do in order to try to get healthier. And they got the stem cells. We briefly talked about those. That's a full cell, and those cells will actually decide what's in the milieu that that the cells need help with. And so that's the cellular basis of what we do. And then, of course, we talked about low-level laser with the long wavelengths, which go in and do the same thing. The epigenetics is where we seem to be going on a molecular basis with this. The best example I can give is if I look at a piece of your muscle under a microscope and some of your bone and some of your skin, they don't look anything like each other. Bone doesn't look like muscle, doesn't look like skin, but they all have the same 46 chromosomes. How is it that the same DNA looks the same in all the cells? Well, that's because most of the DNA is turned off. Only the part that's important for that particular type of cell is turned on. Well, we can manipulate some of that. We can turn on some of the collagen that we want to have, type 2 collagen for the joint. We can turn on type 4 collagen if we want some of the tendon to get better. And we're learning to manipulate that both with the low-level laser works a little bit on that area, but certainly the peptides do. You have these peptides, these small little amino acid signals, and they go right in and they signal some of these epigenetics on the histones in order to be able to turn on all of the right and correct molecules that you want, and you want the proteins to be made. I think we're going to see more of that as time goes on. We're going to be able to manipulate more of the epigenetics. In the meantime, we're still working on snipping out the DNA and doing the stuff, as you've pointed out, which seems to be where most of the good success is coming. But I think we're going to get down to a little micro treatment with the epigenetics.
Well, one of the things that I am very interested in is diversity, equity, inclusion, and we're doing a study now with newborns with Children's Hospital Los Angeles, and we do cheek swabs from the babies, cheek swabs from mothers, and we're just looking at adverse childhood experiences. So, if your parents divorced, have you ever heard a gunshot, and so forth. So, and so far, yeah, there are changes, and we know that the incidence of heart disease, hypertension, all these, when you're in that high ACEs environment, it's changed. So your body does turn itself on and off. We also work with Cedars-Sinai doing induced pluripotential stem cells. So we'll take a cheek cell from one of my cystic fibrosis patients, and I can build a lung from it. So and then we can not have to take their lung out to try different medications and approaches. So we are, pretty much here in the future. How about hair growth and red light?
Okay. Well, I have to be honest, I don't do a lot with the aesthetics. We do have somebody in the office who does aesthetics. I stay more with the physicality parts that we've kind of talked about. So I don't want to mention something that I don't think I consider myself an expert. But I know there are people doing it and getting some good results. HCK. With copper, which helps grow a lot of the new collagen in the skin, and they're getting some good results with that. So obviously some of the aesthetics is working nicely, and we are depending on the peptides to actually increase the collagen growth. We've got some good studies showing that. And I think you're going to see that not everybody is going to need plastic surgery in the future. That my plastic surgery colleagues may not be thrilled to hear that, but I think we can help with your normal molecular system rebuild some of the tissue to kind of slow down the appearance of getting older.
Well, and the other is sports. I mean, you must be doing sports medicine as well. And those guys, I had one of my kids at age 12 came in and he had a right middle lobe that needed to be taken out. And his coach said, you know, you've got to do it. I go, oh, there are other things we can do. He goes, no, no, no. He's going to be, and he ended up playing for USC and played for the Dallas Cowboys. And I ran into him and he has new shoulders, new knees, new. He said, oh, thanks, Dr. Landon, for getting me into this. So how about in sports? How are the sports figures taking to this? I met, or then Hollywood celebrities and like, so.
Yeah, as a matter of fact, during the, what's the kickball,
Soccer?
Soccer, rather, they come every 4 years, the World Cup.
Okay.
We had one of the World Cup people flown in from Turkey. He had had a problem, nothing was working, and so we were able to inject the stem cells in the area. He did very good. Now, I also used to use the peptides on them, but somebody just discovered that the peptides actually work really well. And they've said, you know what, this is a performance-enhancing drug. So you can't use your BPC 157s and your stuff anymore, where before it was fine, they were just testing for drugs. Or they were checking for the doping, for the blood doping. They kind of left the peptides out of it. And then somebody did some studies and found out it really did make a difference. So it's good news, bad news. It's bad news for my athletes because I can't use it when they're participating. It's good news for my patients because it proves that this does work and gives them a little confidence that what they're taking does work. But we get a lot of athletic related injuries. We got kids playing in sports, you know, they're playing younger and younger nowadays. We got kids playing in football that are smaller, and you have to worry about growth plate injuries and other things that you got to be a little careful of. And people want to go to college. Some of them are dependent on getting a scholarship, so they're playing really hard, and they do get their injuries, and they pay later on. I mean, when they start to hit their 40s and 50s, these are the people who are really going to need regenerative medicine, because if they don't, they're going to fall into the old system, getting their total needs at 45 and 50 years old and getting them again when they're 70.
Well, how about these cold baths and hot baths and all that? I mean, we're doing something with Bloom out of England, and the doctor showed getting the skin temperature up to 45 degrees and pulsing that the healing after mastectomy, those heat shock proteins would come out, and so that's worked in the middle of a study there. Yeah. I worry more about my athletes because they have 2 years, if they make it at all, they have 1 year or 2 years, and then a lifetime of misery. Right. So are you seeing those besides us weekend warriors?
Yeah, we do see those. I tend to see them more after that 2-year period. Right. I see them where they've gone through everything, they've done the hot and the cold, they've been able to get the massages. A lot of them have had a lot of steroids, which I'm a little surprised they still do that, doing steroid after steroid. I think we've got a lot of proof that's like really bad idea biologically. But they come in and they said, well, you know, I finished my college career, it was great. I didn't go pro, but I was there for the college. And you finish college, you're in your 20s. You come in with a knee that looks like you're 50. And as long as they come in, and we're going to get that group of athletes that have, and they're high-level athletes, because if you're playing college ball, you're not. This is not a weekend warrior kind of a thing, and they've really beat themselves because this is how they stayed in college. And some of them hoped to go into the national leagues, and they didn't make it, but they worked hard to do that, and they pay the price later on. Our biologic systems can take so much trauma. They tries to react the best it can. But you get enough trauma on joints, you're going to adversely affect cartilage, subchondral bone. We can do something about that. We can actually put something in the subchondral bone, get to the joints if we get you early enough. So my advice to people that do athletics, if you find yourself having the pain or some problems, take care of it early, because you'll find we may be able to augment any of the biologic processes, which is going to be easier in a 28 or 30-year-old than it's going to be in someone 70 years young like us.
Yes, well. And how, on just a personal note there, so how do you keep yourself in balance?
I try to keep myself in balance between.
So you're in 5 different practices.
Yeah, I try to. I'm lucky. I have a very good family. I have an understanding wife of 50 years. I know this, everybody says this about their family, but I got fabulous daughters. I get along great with my son-in-laws. I have grandkids. life is just great, and I get to spend time with them. So I have family. I have time. I work out, and I enjoy the athletics that I do when I work out. I do things for myself that I enjoy, whether it's playing an instrument or whether I've been in martial arts for decades, and I enjoy that. I am careful what I eat. So I don't want to be one of those big belly ones that you described. Same thing. I don't smoke, and so I take things that I know will be helpful. I do take some of the telomere lengthening medications as well. I take things that will naturally keep some of the cholesterol lower and will increase the sirtuin-1s. You know, sirtuin-1 is the gene that is a longevity gene. Normally, sirtuin-1 you can only stimulate it with calorie restriction.
Yeah,
they found there's a nice balance between leucine and a few other things where you can take this. It's a perfect balance where you will increase the SIRT1 and keep the mTOR down, which is the really inflammatory stuff that comes up the really active tissue. And in combination with that and what I do, T65, which is lengthening the telomeres, I try to do a little bit of everything that I think is helpful. And I take the routine. I take vitamins. Okay? I try to get sleep. I don't get 8 hours sleep. It doesn't fit in with what I'm doing. But I try to, I'll take 6. Okay, but getting 8 hours is healthier. And I know that. So it's like the guy who's skydiving. Okay, he skydives, he knows the risk. Oh, I'll get 6 hours of sleep. I don't think mine is as dangerous. Okay, so that's what I kind of do on my own to keep me running. I'm 72, and I'd like to be doing this until I'm 85 or 90. And if I do the right things, again, we talked about the not just how long you live, but how the health span. I would like to be healthy all the way through, and I do the same advice with my patients.
Well, sometimes my patients say, "Oh, I want to live long." Well, sometimes you just need to have picked different parents too. There is some genetics in terms of long life, and then with the blue zones in terms of what's happening there. So it's good to hear that you're incorporating this into a balance there. What, do you have a sleep routine since we're...
You know, it isn't. When I get home and...
your brain has got to be working.
It does. I mean, I have to admit every once in a while, if I'm thinking too much, I go to bed, I'll still be awake a little bit. I try to kind of, before I get home, just kind of relax. That's why I'll sometimes pick up my guitar and do some stuff for an hour or so. Yeah. The music does help down-regulate some of that neurological run that I can't get out of my frontal cortex. But that works fairly well, and I do sleep well. You know the old joke, you sleep well, you don't have a guilty conscience, no guilty conscience. I sleep pretty well, but again, sometimes you have to get your brain to slow down. I do it by music. I do it by my own playing the guitar when I'm watching TV. Watching the news at night isn't always so helpful, but I got to keep up what's going on.
And then I know you go out to Lancaster. What happens out in Lancaster? Well,
in the Lancaster, we mostly take care of the military and their families. I've done that for 20 plus years because they have Edwards Air Force Base up there. And I think we owe the military a great debt. I think we all have our freedoms here. And it's, the old joke, freedom's not free. Somebody had to fight and die for it. And they still continue to fight and die for it. And so I think everything we can do for our military, for our veterans, and you talk to one of the Navy admirals, he says, one of the toughest jobs in the Navy, he says, is being a Navy wife. He says because they go out, the Navy people are, or Navy spouse, excuse me, that's the correct term nowadays. The other one, because they're deployed and someone's taking home, take care of the kids. It's very difficult giving as much help to our military, as well as our first responders, including, our police officers. We see, it's a dangerous job now. They're getting shot. I mean, you really have to be someone special to put on a uniform. I don't care whether it's a military uniform, whether it's a police uniform, whether it's a firefighting uniform, because, your family doesn't know, for sure if you're coming home. It's got to be exceedingly difficult. I think all the support we can give to them, the better.
Well, and they're moving a lot too. I'll take care of the kids at the Navy base, and they're just, in 3 years, I'm going to be somewhere else, Dr. Landon. I'll be in Okinawa, or I'll be in Lancaster, I'll be somewhere. That's just stressful on the families, and giving them permission, a place to talk too. They're just, if they sit and talk to the psychiatrist and someone from their unit sees them, then they don't come back. So this whole post-traumatic stuff, do you see that? moving into their backs as
Yeah,
well?
I do. I do. I think it's part of what we try to do physically, and again, it seems to show. They do some cervical stellate ganglion blocks they've been trying on the PTSD patients. Generally, we have some new things we're trying, along with the psychologics, because you still have to see the psychiatrist, you still have to take care of those psychologists, but if we can help them by means of affecting the sympathetic, parasympathetic systems as it goes into the thalamus and the hypothalamus, the prefrontal areas, and one of the newer things we're looking with brain injuries is a peri-spinal injection, which we're using actually in Intercept. They're doing it with stroke. They're doing it with patients to try, and goes right into the center where we have the they've got good studies showing it goes right to that center of the brain, into the choroid plexus, and the choroid plexus spreads out into there. And so I think we're trying to move into an area we can help them better, because we still get too many suicides, too many homeless, on the street, taking drugs. We got to try to do something to at least help our military with regards to that. We can't just, you can't just throw them away.
Yeah. Well, we had my phone just went off there, but we had an app that if you're within 100 feet of a gun range, 100 feet of a liquor store, then calls for psychologic help, which my phone had just done. Well, Dr. Fishman, thank you again for all your engagement in life and regenerative medicine, so that we are going to live a full life without health problems as we age. So Ventura, you've heard a lot. We've heard stay healthy. There are things within your own body, if we can just unleash them, if we can get in the epigenetics, if we can unleash what our own body uses to protect itself. These are what's left of our Neanderthal genes. Well, we're living longer than the Neanderthals, and sometimes there's some wear and tear as well, but let's try and be proactive in our health care and increase our health span. So Ventura, time for you to get moving.